So to build on that a little bit, I mean, what is interesting and was surprising, we talked a little bit about this earlier, is that obviously there's a perception of great affluence in Santa Barbara, and that perception is a reality for many individuals and families. It also has a really robust ecosystem. You've got good university system, you have incredible natural resources, and I was told that there are more sort of nonprofit organizations per capita in Santa Barbara than any place in the country. So you have what should be an infrastructure to basically reduce or eliminate many of the disparities or equities that we are touching upon. And I'm just curious, at a 30,000 foot level, what do you think sort of prohibits making greater progress on these issues? Is it the silos that we mentioned before? Is it lack of resources? I'm also not too familiar with sort of the tax base of the city and how things are done, but I'm just curious from your perspective, because it is somewhat surprising, and I'm just wondering from what you see or what you've learned with the resources at hand, why are we where we are?
That's a great question, and I don't know at what part of this answers that, if it's a small part, medium part, or large part, but I do know that some of the issues that some of my families, when I was at Washington, faced connecting to local resources was they were undocumented families, and so that fear of didn't want to out their status to an agency, or them believing I'm not a citizen, I can't have access to that. That was difficult. Although many of their children are citizens, but some of the parents aren't, and so that was one of the things I would hear. Well, I wonder, get them connected to this service or that service, and there was a reluctance, and I don't understand that, but that I know that plays some part. I just don't know what.
To give you an extent of that, again, from this morning group, someone told us that there was even a reluctance among some families who were undocumented to sign the emergency waiver. That if something happened to the facility to call the emergency room, they didn't want to sign it because of the fear of repercussions. What other kinds of things have you seen or noticed or feel might contribute to?
I think families who are in poverty, their margin for error is so thin that if they're out of work for a month, they lose their housing. If they have a major illness, it could set them back 3 to 6 months of family income. I think that's what middle class and certainly the high wealth, you can absorb a challenge. You've got either money or family resources, but our families in poverty, they can get thrown off a trajectory so fast.
Yeah. Does the housing situation here and the expense of it make that margin even thinner?
I think
so. They're migratory. I would have kids that enroll, unenroll, a lot of couch surfing or sharing of housing, things like that. Puts them around.
I don't even understand how our Latino families can even live here with the cost of housing. I have to get on the ground and
it's multiple families.
Yes, I'm sure multiple families in homes, but even still, it's like Santa Barbara is just so expensive. And then the geography is what creates some of our challenges. Mountains and ocean and lack of water means housing growth is either 0 or 1%.
As an aside, what is the general sense of affordable housing? You get to the point, not just for those living in poverty, but the fact that teachers can't live here, or people who are municipal workers or whatever, cottage health. I'm just curious, is there?
I don't know.
Well, I have an 1,100 square foot 1957 original house. It's probably worth $1 million. So
Yeah.
It's 1957 original.
Right, but there's also you can't build high here and things like that. So there's a lot of restrictions that would.
So 2 teenagers and a young son still living in the house. We looked at we're looking at doing a remodel. So we're happy with 1,100 square feet. 1957 original right now.
Yeah. My mom's a big fan of the show on TV, Tiny Homes.
Oh, yeah.
Yeah.
Well, they should do a feature on us.
Could you talk a little bit about the populations that you serve and how, what their makeup is? And I don't, again, not just students, but also teachers or people who work in facilities or what have you, and what your sense is of their health challenges, or what you see in terms of like this, hey, we're really seeing this more and more from teachers, or we're seeing, I think I mentioned earlier, mental health needs even at the youngest of ages. What kinds of things are sort of coming up with the populations that you serve?
I would say what Bill brought up, the mental health issues, and I would say across the board, even with staff, are so much more prevalent. I've been in education for 25 years. Many of those years in a classroom, more than 25 years. And just thinking about, I grew up in California, and having friends or whatever growing up who were being supported in some way, whether through medication, psychiatry, psychology, for mental health issues. I don't remember anybody when I was growing up. But the amount of kids that come in, even in kindergarten, first grade, second grade, with indicators that they're being supported in some way for mental health issues, is astounding when you stop and think about it. And I would say that runs through the staff, stress levels high, and people dealing with issues. It seems much more prevalent across the board, mental health issues.
And what's the experience been in terms of either programs that have been effective in mitigating that, or barriers which make the mitigation even more challenging?
I don't know that it mitigated it or that, I'm not quite sure how it did, but there was a phenomenal program brought in. I don't know where it originates. It's called Mental Health Matters, and Ann Lippincott from UCSB actually brought it into my school at Washington, where they educate students about mental health issues, and so it lifts up some of that, that veil of secrecy about it and brings it to light, because so many kids are affected some way or another, whether it's from a family member or a friend or something. That was what I felt was a very effective program, just to get them to start talking about it. So, because around that age, 6th, 7th, 8th grade, that's where you see a lot of issues come out. But I don't really know what, I don't know what has started that swell, whether it's better identification, over-identification, I don't know.
I would concur about the mental health issues. I as a superintendent of a K-6 district, even probably a K-12, I think one of the challenges for healthcare is that so much of what happens as we age, and that some of the habits are things, the exposures that children are experiencing before school and through elementary school may not really be yielding health issues that are as apparent until they age. And, we have a very strong attendance rate. We have a very high vaccination rate that has only gotten higher with the new laws this year. We don't see a lot of absences due to illness. We weren't tremendously affected. There was a bit of a pertussis outbreak last year, and I think we had a couple of kids that were affected by that. But in general, the medical part of it, as opposed to the mental health part of it, is I think opaque by the fact that these are probably kids that may see something in them in their adult years that perhaps had we known better, we might have been able to help. I'll also say that we're very proud of the work we're doing around school-based nutrition. Scratch cooking, things like that, and locally sourced produce. And even our wellness policy, which has become very, very specific about what parents and teachers can give to or feed kids during the school day and how we do that type of thing. And we provide breakfast at all but one of our schools now. And I want to just put kudos out to the partner district of Santa Barbara. We have an ACES program, an after-school program, where kids are served in school outside of their neighborhood. It's the only neighborhood school that's bused out of the area because 30 years ago, their neighborhood school was what's now the Goleta Community Center. It was unsuitable because of earthquake standards. So at the time that school closed, we met that population, which is among our most difficult economically. So they have an after-school program where we bus them back downtown and they go to the Boys and Girls Club. And they're there from 3:30 to 6 o'clock. And there's a truck that comes in from the food services at Santa Barbara that these kids can get dinner. And I know that happens throughout your community, but it's not just your community and the high school students that it's affecting. It's kids in our school district that are benefiting from that program.
The mental health environment in schools, I think it's been changing over the last 20 years. I don't know Santa Barbara well yet, but Silicon Valley. I taught in the 80s. It was nice. It was pretty simple. We just taught, and of course I was in a Highwell school, so it was different. But in the 90s, I started seeing high school kids really stressing out. Part of it was the college admission scene. We would hear stories about how hard Berkeley was. And then ever since, I'd say 2000, the mental health scene in public schools has just gotten harder and harder, to the point where a lot of school districts are having to provide mental health services on campus that we didn't even think about in the 80s. Today, it's essential because our guidance counselors, our assistant principals, they're not trained to deal with mental health situations. So, just a data point, the statistics in Silicon Valley, about 11 to 12% of teens have in some way attempted suicide.
Wow.
10 to 11%.
Whether it's a real attempt or a self-reported, I'm just really
That's from
stressed
the
out. Yeah,
Kids Survey.
it's from Healthy Kids Survey, but it's our own surveys. And then where it hit home for me is in 10 years of being a superintendent, I had 7 student suicides.
So in your 10 years, you see these changes.
On my watch, I had to do
It's
it.
dramatic, isn't it?
Yeah, and it's spilling up to the university systems.
Yeah, sure.
And so,
Can you attribute, what is attributed to this? Or is it because some kind of changes of the society?
I would say it's
Medicare or
all kinds of things. I think social media makes it more public. The stress of getting into college, the competition between families through their kids of who's going to college. My colleagues in Palo Alto, that was just like ground zero for the suicide cluster. And those high school kids were just under...
What about medicine?
I
New
don't
medicine?
think
or
so.
Legal changes? Or does that... there must be a variety of factors.
Yeah.
Yeah, I think it's mostly the societal pressure that we put on our kids, and then the adults are competing like crazy with...
But that's
Their
Silicon
peers.
Valley though. Some of
It's Silicon Valley, and I think it's
That's more
probably
I'm
worse
sure
there.
Yeah.
But I'm sure there's a factor here too.
But the broader sort of question is this idea of mental health versus sort of like your own physical health. And it's interesting. I think that as a country generally, there's been a lot of progress that's been made in terms of nutritional standards and sort of physical activity and trying to make sure those things are in place. But again, in a previous conversation we had in Connecticut, where we were asking them, and this was in a poorly resourced school, they made the point of like, yeah, you know what, if we use a new salad bar and some better equipment in our gyms, yeah, we could. But if there's a kid who comes into class and someone has just been shot on his block, and he doesn't even have to have seen it, he just knows it happened, then we've lost that kid for 2 weeks, maybe longer, before he can even focus on anything. And we've heard other feedback in the community about sort of just how stretched this mental health system is in Santa Barbara. And I'm wondering, are there more things that are happening now in school to address the variety of needs, whether it's parental pressure at one end of the spectrum or the toxic stress that comes with poverty at the other? What is the role of the school in trying to, get the resources for the child who, whether it's screening and see if there's something so you can sort of detect something earlier, or whether it's treatment when red flag comes. I mean, where is the school?
Well, I can speak from a district that has been well off financially in what we have done. We have way overstaffed according to what standards are about the school psychologists that are in our school system. These are school psychologists typically used for identifying students with special education needs. And in an elementary school, you might have one that serves 2 or 3 schools. We have one at every school, with the explicit expectation that the portion of their work that is not about special education is dedicated to counseling and family intervention. We also have, for 9 schools, I would say 4 of them that are heavily impacted by Spanish-speaking families and English learners, 3 full-time community liaisons who speak Spanish, so the families can come and get information and they can help point them to services in the community. One of the problems that we've found recently in communicating in this kind of listening environment, if you will, with our English learner families, they love this. This is one of the services that they feel most strongly about. They asked us to expand it by 1. We did that for this year, but before hiring it, we started to have a conversation and say, we don't need 1 more community liaison. We need somebody with better credentials. We need somebody that can help supervise, and what can we do to get a licensed clinical social worker on our staff? And so the difference in cost between a community liaison and a licensed clinical social worker is probably about twice in big terms. But we were able to dedicate the budget that we had set aside to that community liaison and use other resources through Medi-Cal, and some reimbursement to patch together a twice as expensive position to look for a bilingual licensed clinical social worker that might help us connect these more serious mental health issues into the services that could exist in the community.
We heard this a little bit more with the adults, less with the children, but where the acknowledgement of mental health issues as a real serious issue, and one that's not associated with a personal failing, is problematic. So the idea that that even talking about my feelings or my emotions is not culturally easy for certain groups, or that when you get to the point where now you may have been diagnosed with something. I mean, there's a lot of complications there at the adult level, and I'm wondering if you see that with the children, or whether parents are more open and receptive to it.
It definitely, I'd say, trickles down, and that's why the program that I was referring to earlier, when I was at Washington, where they went in and trained kids how to have those conversations. But I think without that, I don't think a lot of parents are even talking to their kids about, mental
So they
health
train the
issues.
kids how to have the conversation with their parents.
They just train the kids what the mental health issues are.
Yeah.
They narrowed it to 6. And the signs and what, they normalized it. What percentage of the population gets it, what, how you would treat this, what kind of support is available, and just kind of lifting up some of the, just normalizing that this is, it's okay, But I would say without that was the first time I'd seen that program, and I would say normally, there is that big secrecy, or, you can't talk about it, or.
This is one of the hopes of elementary education, is normalizing conversations and community. I'll use a completely separate example, but sustainability and recycling was accelerated greatly by teaching young children to bring that idea home and having parents adopt it and these kind of things. I think the same thing could very well be true in terms of that lack of stigma in talking about mental health.
Mm-hmm.
And we as leaders and adults can set examples with that. So my wife's a marriage family therapist, so I've been around the field for 20 years. And, I'm really honest and almost proud to say, yeah, I'm in therapy off and on for the last 15 years. You know what? It's coaching, it's life
Yeah.
coaching. And in fact, I tell half of my administrators, hey, you really need some therapy.
Don't do that, Carrie. Don't
Because
do
there
that.
are some behaviors that are
Don't do that.
emerging that are,
It was nice knowing you.
Particularly if you're thinking about being a superintendent.
well, you know, if you get into like these level of jobs, you really have to be a psychologist to manage the emotions of people. So I think some of our...
Or you have to be crazy. I'm just kidding.
Or you have to be crazy. And I think for some of our immigrant cultures, therapy is such a foreign
Oh, yeah.
concept.
Yeah.
Like, I think our Latino families, they're not as opposed to it as some. Like the Asian cultures are like, they don't do therapy, they don't do emotions, but that denial was leading to just really bad outcomes for their kids. And so I think it gets compounded when you have children who are either born in another country or born here, and they're being parented by parents who grew up in a different country and culture. And so I call it living in two cultures. So these kids who grow up in an American school and their mom and dad were born and raised overseas, the disconnects are really, really hard. So
Yeah. On a related note, to the extent this contributes to mental health or stress with children, I mean, how aware are the children in this area of the disparities that exist? Is there a contributing factor to knowing that there's such wide disparity? I mean, maybe not because the schools may have some level of segregation, or maybe not, but I'm just wondering how that may affect their psyche or their well-being.
I think it kicks in middle school when you see the mixing of these 99% Latino schools. So when they're in an elementary school, it feels normal because they go to school with kids and families that look identical. I think when they go to Santa Barbara Junior High or some of our high schools where it now gets to be a little bit of mixing of wealth and poverty, they start to realize.
Even in like at Washington and some other schools, there's still that mix.
Yeah, I've already heard stories on the ground with even middle class kids. They feel great until they go to junior high or high school and they hear the stories from families of wealth and they go home and they say, Mom, why are we so poor? You know, and they live in $1 million house, but they hear the stories of the Montecito kids. They have a private jet. They go to Europe for spring break. And that's just going to mess up your view of the world.
Yeah.
That's where Santa Barbara, I find it just fascinating and unique and really challenging. Because you don't get that mixing of super high wealth and poverty in one city or school district. I've never seen a district that has that.
It is, you're right.
It really is
It's very
unique.
unique.
Yeah.
Such extremes.
Yeah.
Yeah. Moving away from the mental health discussion for a second, are there other things that you see within the student body, or it could be within your teachers, or it could be within families or other employees of the district, that are health issues that you just sort of see? Like, I don't know, over the course of time, obviously we've seen the rise of child obesity, although it seems to be waning a little bit. Diabetes that sort of comes in along with that. Are there things that you have seen that you either have addressed and seen success with, or like, hey, we really need some help on this because this is new and we're not sure what to do?
Well, I think you hit a big one, which is, even though it's waning, is the obesity thing, and that ties into making healthy choices with your exercise, getting away from tech, getting outside, and making right food choices. Says the woman who didn't eat the beets but ate it.
I've been staring this plate down for a while, looking for an opportunity to go in there.
We're just waiting until
That's right.
Great, get in my personal splitsy with you. No, but I think that less so here actually than I've been in other communities where I've seen that lack of physical exercise, that kind of you see kids that I feel are, they show up to school with hot Cheetos, as their mainstay in their lunch, those kinds of things. And something I fight all the time with my kids, no, we're not getting that, just because
Yeah.
that's what they, oh, but everybody gets to bring hot Cheetos for lunch, So just, I think that obesity thing is still huge, and I think it goes with our staff also, just trying to find that balance of time, to eat healthy, to exercise, and to reduce stress, just having that balance.
Yeah, the Cheetos thing reminds me, I volunteer reading to a kid in a school that is largely, people below the poverty line. And the reading programs are at lunch. And one time he did that, he brought in a bag of Cheetos, right? And I was going to the point of judgment, like who made the bad choice to make this happen? And then as I unwound the story, it was that his mom had come home from the third shift and gave him money.
Mm-hmm.
He then went to the one store in the community where you could go to, and there was no fresh food. He then brought that, and he was going to sort of supplement it with whatever he could get in the cafeteria, but at the end of the line, they ran out of peanut butter and jelly sandwiches. So here he was
That was
with
his
this.
only thing,
Yeah, there was still a question of judgment, but it was a lot more complicated than like
Sure,
the
than
mom made a
just
bad
that.
choice or he made a bad choice.
Yeah.
Are there other sort of issues that you guys sort of see cropping up health-wise, or?
We have a generation of parents that feel like they have to drive their kids to school, even though they might live 2 blocks away. And I walk to school. I rode my bike to high school, and today's parents think it's unsafe
It's bad parenting.
to walk 2 blocks. And so I think we have kids and parents that they're driving too
Yeah,
much.
yeah.
And I think we've lost touch with a walking community, a biking community.
There was a book called Last Child in the Woods that looked at the phenomenon, the fact that our kids don't spend time in nature. And there was a study out of Duke, and this was 10 years ago, so it's probably even worse, but from one generation to the next, the circumference by which a child would be able to go in their own neighborhood was 1/10 of what it was.
Exactly.
Oh, I'm sure.
Exactly.
Yeah. What else are there? I mean, someone mentioned devices and sort of like media literacy or things like that. I saw one study that suggested that up to 50% of kids could be nearsighted by 2025 or 2050, I think it was.
I don't remember that. I think that Bill was talking earlier about some of the things we're yet to see, and I think technology is one of those now commonplace thing in every child's life, even
Yeah.
low poverty children. And it will be very interesting to see what comes of that health-wise,
Yeah.
mental health-wise. I think a lot of those things are still unknown.
So in the context of your schools, looking at sort of health defined sort of broadly, what is the role of health screening for any of this kind of stuff? Is it something that happens or doesn't happen? I can only speak from my own child's experience where you have to get the checkup and shots and then that's the extent of it. And on the other hand, I've seen people that are suggesting should there be mandatory ACE testing, adverse childhood experience that happens to sort of see if a kid is coming to school in situations that may be problematic.
So here's a domain that would be an interesting one to try to figure out. So vision. A lot of our poor families, they don't go to optometrists. Their kids are not screened for vision problems. And I wonder what % of our learning issues are because kids can't see the board or the screen, or they can't read here, but they don't know how to access optometry services. I actually talked to my optometrist back in San Jose, because there are devices now, a camera that can take a picture of your eyes and get the prescription 95% correct. And you could take that and get a $30 pair of eyeglasses. But our healthcare system in the United States will not allow that, because it has to be dispensed by a professional. And I talked to my optometrist, is there any way around this? Because I had students at some of my poverty schools that I'm sure they needed eyeglasses, but I didn't know how to solve that.
There are screenings for vision and dental and hearing, but they're very, very low level, cursory, and I'm sure, I don't know what the capture rate is for issues, but I'm sure it's not as high as it should be.
Are there things that you would like to see either the community providing more of or Cottage Health that would create a situation where kids were going to school sort of more prepared and able to learn because there weren't any of the health barriers, mental or physical, that we were sort of talking about?
I think for our families in poverty, if we can bring the health services out to community-based centers, it's a step in the right direction, because a lot of them don't have health insurance, they don't know how to access it. Transportation's an issue, so, and it has to be light touch health services, because it's community-based, but whatever we can provide through a school setting is a step in the right direction.
Are there any community, school-based community centers in Santa Barbara?
I think,
Okay.
I think I have some. I think Franklin's got
has
one.
Yeah.
Yeah.
But that's a neat model that if it could be replicated, where the school serves as the center to get access to all kinds of
Mhm.
supports. I think to answer your question, another area that where schools could partner with health organizations is in getting, prophylactics to students, and that education about reproductive choices as far as preventing pregnancy and things like that.
Would there be
Um,
openness to that?
On my part,
Or
sure,
cultural-
come on in, my
cultural
sixth graders really,
openness?
no, just kidding.
Yeah.
I don't know, I can't speak for, I mean, I'm a mother to a senior at San Marcos High School. I'd love for there to be an office that high school students could go into, to get access to birth control.
Is teenage pregnancy a significant issue in Santa Barbara?
It's not as huge in this community as it is in some other parts of the state. We're not considered like a hot spot, but
Yeah.
it's always an issue, yeah.
Yeah. Are they considered a hotspot for any other kind of adolescent health issue? Or child
I don't
health
know.
issue?
Yeah, haven't been here long enough.
Yeah.
to know.
Anything else that you would, if you had a magic wand and you could just sort of make something happen that would create a healthier environment for, again, it doesn't necessarily need to be just students, it could be, people who work in the schools. What would you want to happen? What would your wish be?
I think the adults that work in our system have their own health challenges. I listen to what people are provided in terms of support in the high-tech scene, and what we can provide our employees in terms of wellness is so limited, because we have to spend our 99.9% of our money on students. If we spend any money invested in our adults, we get criticized. But I just look at the health challenges of our adult workforce, and I wish we could support them, but it's really hard politically. And so when health providers come in and just offer some systems and support, our HR teams, I just know mine, they're so under-resourced, they can't think about employee wellness. They're just trying to get teachers into classrooms.
Right.
So I think the adult population in school districts is pretty neglected, whereas they probably can compare to other colleagues in other industries that go, they have food services on their campuses, they have gyms, they have all kinds of stuff. We have none.
Yeah.
They're lucky if they can go to the bathroom on a regular basis.
Right. Right.
I think it's not a politically correct answer, but I think mine would go back to that reproductive health. I think if people really truly only had a child, when they it doesn't even have to be fiscal resources, but even just emotional
Yeah.
resources to take care. I'm also a registered foster parent and have foster kids to the foster care system. So, if I could have a population of people that were ready and willing to parent when it came time to parent. And again, I'm not even just, there's fiscal resources, but if you were emotionally ready to truly parent all the way through, I think we'd have a very different society.
Bill, you got a wish? It could be affordable housing for people who work here,
Yeah, that's part of it. I will say that Santa Barbara County, for schools that are not, for districts that are not large enough to do their own health insurance, we're primarily using a pooled resource that comes out of Kern County. And Santa Barbara County is the only one in the state that I'm aware of that allows opt-outs from insurance by simply having, in most cases, these kind of collaboratives, the VIVA in San Diego, require every employee to take health insurance. In San Diego, at one point, they said, if you have a spouse who works in another industry or another school that is covered through VIVA, you can do that together. One can opt out. But we're the only county that's left where somebody can say, you know, I have another way to get insurance, and I can prove it to you so I don't have to take that insurance benefit that you're providing. In our particular system, we have probably 150 of our employees. And we provide what I think is a low amount toward their premium of between $8,000 and $9,000 a year, and they have to make up the difference. And the difference is whether it's a single or a family difference, they have to make that up. But we also have the highest experience rating in the county. We consistently come back with the highest amounts of increases based on usage. The trusts that we belong to don't release the individual information, so we don't know all of the specifics. At one point, our district decided to move away from the trust and tried to go with a brokerage on a self-insured basis. And the year that I arrived, the increase was going to be 50% if we didn't change back into the system. In our circumstance, we provide the money if you take the insurance. If you don't take it, we don't provide it. There are systems that do this kind of, here's your cafeteria fund, if you don't take it, you can get some of this back in salary. So for us, we have this dilemma that we need more people in our pool, because I believe our exposure rating, our experience rating is a direct reflection of the fact that we have a polluted pool. The people that are in our health pool are the people that need it, and the people that are healthy are getting it cheaper somewhere else or through somebody else. And so we don't have a balanced pool, and that's why our rates keep going up. And the problem is, I would love to say, gosh, you know, if everybody was required to take insurance, the pool would be what it's supposed to look like. But it's $1 million a year to go from where we are to giving everybody that insurance. And that's not something that we can afford on the scale that we have. My teachers, as we negotiate our salary, they don't want money going toward their benefits. They want it in salary. And for what I didn't understand for a long time is the really rational reason that if they negotiate money for their insurance, they're only negotiating it for half of their members. Because those people that have opted out then get nothing from it. And if we negotiate it for everybody, then nobody gets any additional money because we can't afford them. $1 million would wipe out any kind of a raise and then some that we could give. So for us, there's a very important fiscal part of the health of our organization that I'm just struggling trying to figure out what the way out of it is. We have a school board that's very interested in having more of their compensation going into health services for them. But there are too many good reasons why they are going to just cross their arms and say no. And we've learned that if in a negotiation with an agency like this, if we say, here's the resources that we have, and we want to give you this much of it toward your benefits and this much of it for salaries, if they cross their arms and say, no, you have that much money, we want it in salaries, they're going to win in a state mediation. And so as much as we would like to see them getting better benefits, we don't have a way to negotiate it because they have the power to say, just give us the money. So that's kind of I'm really a sidebar to what's going on here, but it is, when I think of health issues for us, that is the number one issue. And we just had conversations with our classified union, earning less, many of them that are working simply to get their insurance. And 2 years ago, they broke away and said, it's okay, give us more money toward insurance. Well, the teacher said, no, we won't take it. And so now we have this bifurcated system that increases our accounting costs and all kinds of other things.
And is that something that over the course of time has just changed dramatically? I mean, the perception is always that sort of like one of the pluses of being a teacher was having good negotiated benefits. You know, and it sounds like it has been hit just as hard by the health insurance industry as anything else.
Well, let me give you an example. We were a super composite district when I arrived. This was just at the beginning of the Obamacare thing where we really can't make that work because we were paying too much money for the singles, right? We went back and looked at where we were 10, 15 years ago, before that time, and the super composite rate, the difference, you know, we're averaging between what you pay for a single and what you pay for a family. You average it all together, there's one rate, and you pay that rate whether you're a family or a single. In education, we believe, you know, a lot of times we say the singles in our organization are subsidizing the insurance rates of the families. And that's okay because most of our employees, our teachers in particular, are going to be families at some point. So when they're single, they get that and they're willing to take that on. I'm rambling a little bit, but if we go back in history, when that super composite rate was in there, if you had broken it out to say single plus one and family, the difference between the single and the family might have been $2,000 a year. Now it's it's 15,000,
Wow.
it's 10,000 a year difference between what we do. So yes, it is a recent scenario that is dramatically affected by the escalation of healthcare costs at a rate higher than inflation for many, many years. That's a huge piece of why this is a problem for us.
Yeah.